there's this newer procedure, which I love talking about, and I know Will does too, with internal brace. And really, we do a lot. We talked about this in the knee. We talked about this in the elbow. But so how does the internal brace help with instability? And how is this a game changer for you in your practice, Anthony, especially with athletes and young kids? And I've sent you some few patients you've done it on. That was some of my Mercer Island athletes. So tell me a little bit more.
Yeah, so this absolutely is a game changer. So the internal brace, as you know, is made by a specific company. No, I don't have any affiliation with them, but Arthrex. So they have come up with this awesome device that is made of a very, very heavy suture. And it's basically something that can augment or protect your repair of a ligament, so that you can get patients going very quickly. So with the low ankle sprain or just the traditional ankle sprain, vast majority of patients will make a nice full recovery and get back to doing what they need to or want to do. But there is a small percentage of patients that unfortunately develop what we call chronic ankle instability, where they can't trust their ankle. They're constantly twisting and turning their ankle. I just had a patient last week a very young athlete who, unfortunately, even just walking on flat, even surfaces can twist their ankle because their ankle is so loose from having had so many ankle sprains in the past. So in patients like this, I love using this internal brace because it protects the ligament repair and I can get them going very quickly. So I generally have them start walking at 2 weeks after surgery and starting PT right away.
And how is that different than before?
So yeah, traditionally, oftentimes not, keeping patients off of it for 4, even 6 weeks. So it's a full month, earlier. There was a recent study in Foot and Ankle International that looked at a military population and looked at these patients with chronic ankle instability using the internal brace, and they found that they could get them back to activity a full month faster. And if you're talking about an in-season athlete, that's a huge deal.
And I think I've heard you do some of this with scope stuff. I mean, I've never seen someone do that before. Tell me about that, and how does that add the benefit of what you can do with these these things, and what things are associated with this too?
Absolutely. So one of the techniques I learned from one of my mentors, Chris Miller, out in Boston, was doing this procedure, or it's called the Brostrom procedure, which is a reconstruction of the lateral ligaments that are injured that can lead to this type of chronic instability. I learned how to do it through the scope. So arthroscopy, as you know, is using small cameras through very, very small incisions to look inside an ankle joint. And you can use small instruments to do all sorts of things, including this procedure through the scope. So oftentimes when someone has ankle instability, they're constantly turning their ankle. There can be a lot of issues in the ankle joint itself. So it's fairly standard to also do an ankle arthroscopy procedure at the same time to make sure that we're not missing anything like a cartilage injury that needs to be treated. And through the same incisions, you can do a Brostrom procedure or an arthroscopic Brostrom procedure. And, one of the, really cool things about being able to do it this way is that avoiding a larger incision where you're worrying about the wound not healing. And then it just gives you that much more confidence in getting patients going sooner.